The bigger picture is how to think and to see what are the relationships in the body and what areas, what regions of the body tie in, and why you might find things in the palpation of the linea alba down the abdomen, what that might relate to viscerally, what that might relate to in the thoracic region or in the cervical region, or the lumbar region, and why. And it's explained to the best of our ability through these various ganglia places, which are kind of collection houses of nerve bundles, as well as these splanchnic nerves, as well as greater, lesser, least, and all that kind of stuff. All right, as well as the sympathetic chain ganglia, as well as the autonomic nerves that are going to come down through. All right. Yes, it gets to be a lot academically, and we don't want you to get lost in the academics, but we want you to be able to use the academics to help you understand what you're feeling with your hands. And again, we said that diagnosis is observation, and your diagnosis will improve and increase in its sensitivity and its accuracy as your education increases. So, educated observation makes for advanced diagnosis. And the more advanced your diagnosis can be, the more effective clinically your treatment can be, because you're mindful of what's guiding you in your treatment process in the first place. Remember that whole thing on attention and intention? Well, your attention levels will change based upon your educated observation, and your intention, your goals, and what you're trying to achieve are also going to manifest in their changes as your educated observation increases. And the hows and the whys to do things, the mechanics of stuff, the hands-on stuff that we're going to do, that's really, for the most part, the easy stuff. It's really the easiest stuff. You can teach almost anybody to do manipulation. What's more difficult is to understanding where you're looking, why you're looking there, what are the relationships, and understanding and appreciating the complexity of the body, but at the same time the relative simplicity of the whole thing when you break it down into its basic nuts and bolts principles. Okay? So we're trying to combine this whole idea of complexity, vast, almost incomprehensible complexity, at the same dichotomy that there's this what? Wonderful simplicity to the whole thing. And I think that's what Still was grasping upon, is that the body's tremendously complex, but at the same time, there's basic fundamental principles that it will follow. Because he believed the body was designed by a higher power, and that the higher power put it perfectly into sequence. And it was just up to us to figure that out and to appreciate that over time.